Good evening. It's Wednesday, March 24, 2021 here in Cebu City. I'm Cherry Ann Lim and this is SunStar Tonight. The Department of the Interior and Local Government will issue a show cause order against Minglanilla Town Mayor Elanito Peña. This after the mayor had himself inoculated with the AstraZeneca COVID-19 vaccine yesterday, along with the town's healthcare workers. Chari Coronel reports.
Department of the Interior and Local Government Undersecretary Ipimaco Densing III said a show cause order will be issued against Minglanilla Mayor Elanito Peña, who got vaccinated against COVID-19 despite not being on the priority list. Peña is the first mayor in Cebu who received the COVID-19 vaccine. The mayor was inoculated of AstraZeneca together with the town's healthcare workers yesterday. Peña earlier said that he considered himself as a frontliner since he heads the town's COVID-19 task force. He also admitted that he was not aware that government officials were not included in the vaccination priority list yet. The local government of Minglanilla, in a statement released today, defended the move of the mayor to get vaccinated. Contrary to what the mayor said, the LGU said that the town's vaccination rollout for public and private healthcare workers started last week. The LGU also reported that the Minglanilla District Hospital started its inoculation last March 16. However, based on the data from the Department of Health Central Visayas, only the San Lucas Hospital and Baking Medical Center in Minglanilla have started the vaccination. Aside from Peña, 5 other mayors were also issued show cause order. They are Tacloban City Leyte Mayor Alfred Romualdez, Tibuli South Cotabato Mayor Dibo Tuan, Santo Niño South Cotabato Mayor Sulpicio Villalobos, Legazpi City Albay Mayor Noel Rosal, and Bataraza Palawan Mayor Abraham Iba. The World Health Organization had warned that additional vaccines donated through COVAX facility will be jeopardized if the government's prioritization framework is not followed. The government is expecting delivery of 979,200 additional doses of AstraZeneca vaccine from COVAX this week. Under the prioritization framework, healthcare workers should get first priority in the vaccination program. Chari Coronel, SunStar Tonight.
The Department of Health in Central Visayas may extend the deadline for the inoculation of healthcare workers with the AstraZeneca COVID-19 vaccine. Some 16,000 doses of the AstraZeneca vaccine have yet to be used in the region. Kenneth Torres reports.
Today is the deadline set by the Department of Health to hospitals in the country to use up all their allocated AstraZeneca COVID-19 vaccines before redistribution of unused vaccines. But Central Visayas has 16,000 doses of AstraZeneca, which are to be consumed yet. DOH Central Visayas spokesperson Dr. Mary Jean Luriche said they might extend their deadline for the inoculation of these vaccines, as they understand that there are also facilities who have just received their allocation. As of March 23, the region has used up around 13,000 doses out of nearly 30,000 doses of AstraZeneca vaccines. Luriche said that if they cannot comply with the extended deadline, the agency will redistribute the unused vaccines to other subgroups or even to other frontliners in the region who do not necessarily belong to the medical field. However, they will still have to wait for further instructions from the central office. Central Visayas has been allocated over 100,000 COVID-19 vaccine doses of AstraZeneca and Sinovac. Luriche said they still have to distribute the 480 buffer AstraZeneca doses this week. Meanwhile, 400,000 additional Sinovac vaccines donated by the People's Republic of China arrived in the country. With the arrival of additional vaccine doses in the country, DOH also reiterated that the existing prioritization framework must be maintained. The country is expecting to receive almost 2 million COVID-19 vaccine doses by the end of the month through the government's negotiations with Sinovac and through COVAX facility. Kenneth Torres, SunStar Tonight.
The Cebu City government has finally started the inoculation of its healthcare workers in the barangays and private clinics. Chari Coronel reports.
Over 300 healthcare workers in the barangays and private clinics in Cebu City have been vaccinated today, the first day of the city government's inoculation. The vaccination was conducted at the Robinson's Galleria for those coming from South District and University of Cebu Banilad Campus for those coming from the North District. As of 1 p.m. today, around 200 individuals have been inoculated at the Robinson's Galleria, while over 100 at UC Banilad Campus. City Health Department Officer in Charge Jeffrey Ibones said that there were a number of walk-ins during the vaccination at Robinson's Galleria. Ibones added that while this is a good sign that more medical workers are willing to get vaccinated, this may also cause a challenge in the vaccination flow. Around 1,500 healthcare workers in the barangays and private clinics in the city have pre-registered. The Department of Health has allocated 1,600 AstraZeneca doses for Cebu City. The city targets to conduct the vaccination for 3 days. DOH has given the regions in the country only until today to use up all their allocated AstraZeneca COVID-19 vaccines before the DOH recalls and redistributes this to other regions and areas needing them. Chari Coronel, SunStar Tonight.
The World Health Organization describes anxiety as a common mental disorder. And now a 2020 US-based study reveals that the prevalence of symptoms of anxiety disorder increased threefold between 2019 and 2020 due to the COVID-19 pandemic. Luckily, there's the so-called 5-4-3-2-1 method to help us deal with anxiety. Tiffany Neri, tell us more.
If there's one thing most of us have probably experienced before, it's anxiety. The feeling that things are spiraling out of our control, causing claustrophobia and panic, is not something that is unfamiliar for most of us, especially during this time of the pandemic. To help bring us back from that spiral, we can practice the 5-4-3-2-1 grounding exercise. And here's how. The 5-4-3-2-1 exercise is actually a coping technique for anxiety and panic attacks. It is a helpful mindfulness practice when a person is feeling particularly overwhelmed. And how to do it is just simple enumeration. Name 5 things you can see, like your desk, a lamp, your phone, the walls, your bed. Name 4 things you can touch, your hair, your shirt, your chair, the keyboard. Name 3 things you can hear, the fan, birds chirping, the construction outside. Name 2 things you can smell, your coffee, the essential oils you're diffusing. And 1 thing you can taste, the leftover mintiness from brushing your teeth a while ago, maybe? When people are overwhelmed, they can feel like they have to do everything all at once. But the reality is that we can't do everything we need to do right at the very moment we're thinking about doing them. So it sends us to a panic, an analysis paralysis, or even a sort of spiral. What the 5-4-3-2-1 exercise does is it helps bring us back to the present moment and focus on what is actually happening, pulling us out of the chaos happening in our minds, and from there, we can take a step back and organize our thoughts before tackling the tasks a step at a time. Remember, 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. We hope this method helps you fight whatever it is you're feeling. It really isn't easy facing our inner demons, but pretty much all of us have been through it one time or another, so you aren't alone. We have each other to bring each other up. So good luck and chin up. You can do it. This is Tiffany Neri for Lifestyle on SunStar Tonight.
To get the latest, visit www.sunstar.com.ph. Follow us on our YouTube channel and official social media accounts on Twitter and Facebook. I'm Cherry Ann Lim. Thanks for watching SunStar Tonight. See you again tomorrow. Good night.